Female incontinence is a widespread medical problem. How widespread? According to a recent study in the Journal of the American Medical Association, it affects 1 in 4 women, often after menopause or childbirth. Yet many women delay telling their doctors for years because they're too embarrassed. This despite the fact that incontinence can be treated. NJN News health and medical correspondent Sarah Lee Kessler has the story.
Susan Gannon, a 47-year-old Warren County woman, says she lived with incontinence for more than 2 years before seeking medical help.
It was embarrassing. You were constantly worried that, did you smell, or, did anybody else know that this was happening to you?
How are you feeling?
Better.
Okay, good.
Susan suffered from both urge incontinence and stress incontinence. Her doctor, Michael Ingber, a urogynecologist in Denville, explains.
There are 2 types of incontinence. There's stress incontinence, which is involuntary loss of urine with coughing, laughing, sneezing, physical activity or exercise. And there's urge incontinence, which is loss of urine when a woman feels the sudden urge to urinate and can't make it to the toilet in time.
Yet many women find the condition so embarrassing that they wait an average of 6.5 years before seeking medical help. Dr. Ingber says that's a big mistake.
Because incontinence, we know, leads to urinary tract infection. In the elderly, it's a leading cause of institutionalization. Incontinence in urgency at night can lead to falls in the elderly.
Dr. Ingber says incontinence affects 1 in 4 women ages 18 and up, but is highly treatable.
Not everybody needs surgery. We have dietary modifications, we have exercises we can teach women. We have simple medicines that are very effective. Any pain or discomfort here?
No.
Okay, great.
Susan takes a pill once a day to control her urge incontinence. For stress incontinence, Dr. Ingber performed outpatient sling surgery using a thin mesh that looks like a fancy Band-Aid.
We place this tiny little piece of mesh tape under the urethra to now support the urethra, and that prevents the urethra from moving with exercise and physical activity.
For Susan, those 2 treatments are making a big difference.
Do you have any more leakage with coughing, laughing, sneezing?
No, not at all.
Are you able to exercise now?
Yes, everything's back to normal.
For some patients, a bladder pacemaker is helpful. Eliminating caffeine from the diet can be helpful too.
And breathe normally.
Sarah Lee Kessler, NJN News, Denville.